UNICEF is concerned that Nigeria is already one of the 17 countries which have poor records in social work and may drift into worse situation due to misunderstanding, underfunding, and non-professionalization. Nigeria has less than 9,000 social workers to a population of 180 million people. UNICEF and her partners think the ratio is staggering.
The challenges are huge. If you talk about the issue of child protection alone, looking at the issues of violence, abuse, and exploitation of children, that is huge on its own. And if you're looking at other segment of the population, the elderly, people with disability, the young people, the families that are in need of support, and you look at the number of social workers that we have, you will understand the magnitude of the problem that we're talking about.
Social workers are found in hospitals, child protection centers, home for the elderly, yet students who study the program in high institutions most times are uncomfortable flying their flags.
If you go to the universities that offer courses in social work, every year they are graduating social workers, but most of them, because of the unrecognized profession that the social work presents at the moment in the country, they'd rather work elsewhere, and that is what is responsible for the low number of social workers that we have, amongst other things.
President Muhammadu Buhari refused assent to a bill to establish a regulatory body and professionalize the profession. A move caregivers and teachers say is unfortunate and wants the president to rethink.
A profession that have been practicing for more than 2 decades, and yet we don't have a enabling law. I cannot be happy, especially I working in the hospital setting. I can see the challenges we are facing. Nurses, even the record people, health information managers, they have enabling law. We social workers, we are everywhere. We attend to crash victims, emergency cases that are brought, indigent patients, contact tracing, repatriation in psychiatric, psychosocial counseling, emotional counseling in hospital setting. We give palliative care to cancer patients. We look after the dementia. We look after the hypertensive people. We look after the people that are suffering from diabetes. So we are almost everywhere.
Before the social worker can find his place or her place in this scheme of things, it has to begin with approval of the bill, because the bill provides the structure and the framework for how social workers can operate within the boundaries of the Constitution of Nigeria.
An American professional social worker, Anna Bonilla Galdemes, won the 2014 Social Worker of the Year. She says the profession of giving care is soul-satisfying and wants countries like Nigeria to strive to professionalize the profession.
We have to make sure that people get the same opportunities. And when I see the challenges, that is what I see. Finally, I have a recipe that I can look up to, and I say, this is what we are going to strive for.
As UNICEF and other concerned Nigerians keep the campaign for the professionalization of social worker, it is also their expectation that the president will sign into law a bill to establish the Nigeria Council for Social Work to regulate and standardize the profession. Abulu Osemwahu, AIT News, Abuja.